Hello, and welcome to this video course entitled Preventing Long-Term Complications. I'm Tiziana Cambietti, registered dietitian. When you have diabetes, your daily challenge is to maintain your blood glucose within a certain range. If your blood glucose falls too low, the dangers are immediate. You can view an entire video course on this specific topic on our channel. When your blood glucose is too high, other dangers arise, but over a longer period of time. In this video, we will focus on the most common complications of diabetes. The goal here is not to frighten you, but on the contrary. We want you to be aware of the warning signs and what measures to take to prevent the most common long-term complications of diabetes. The key takeaway for this video course is the necessity of screening for frequent complications of diabetes, including retinopathy, neuropathy, kidney failure, and cardiovascular disease. Let's start with vision problems. Diabetic retinopathy refers to vision problems caused by changes in the blood vessels of the retina. 20 years after being diagnosed, diabetic retinopathy affects almost everyone with type 1 diabetes and 60% of people with type 2 diabetes. Retinopathy is a disease that progresses gradually and can take various forms. Like many other complications of diabetes, retinopathy can be present without any symptoms. In some cases, vision problems prompt a person to have an eye exam, and as a result, their diabetes is discovered. Diabetic retinopathy is the leading cause of blindness in developed countries. The cause of retinopathy involves different mechanisms. Simply put, sustained hyperglycemia, or high blood glucose, leads to microbleeding or fluid leakage into the retina. In addition to blood and fluid, solid deposits can form on the retina, which further damages vision. Some factors increase the risk of developing retinopathy and its course or progression, including long-standing diabetes, high blood glucose, high blood pressure, the presence of dyslipidemia or elevated blood cholesterol, anemia or a deficiency of iron in the blood, or proteinuria, the presence of protein in the urine. And for women with type 1 diabetes, retinopathy may appear during pregnancy. Since retinopathy progresses gradually, it's recommended to be screened before symptoms appear. People with type 1 diabetes should be screened by an optometrist or an ophthalmologist as of the age of 15 or 5 years after diagnosis, and then every year thereafter. For people with type 2 diabetes, it is often unknown for how long they have had diabetes before officially being diagnosed. This is why it's recommended to be screened for retinopathy at the time of their diabetes diagnosis, and then every year or two thereafter. To prevent vision damage, you need to control these three parameters as best as you can: your blood glucose, as indicated by glycated hemoglobin, your blood pressure, and your blood lipid levels, also known as blood cholesterol. When a person with type 1 diabetes can maintain their glycated hemoglobin below 7%, they can prevent the onset or slow the progression of diabetic retinopathy. When blood glucose levels improve quickly, such as when a person was unaware that they have diabetes and begins insulin treatment, the quick improvement in blood glucose levels can cause an early onset and temporary worsening of their retinopathy. Their vision, however, will return to its original state soon thereafter. Maintaining blood pressure within target values can slow the progression of retinopathy. And finally, the presence of dyslipidemia is a risk factor for more severe forms of retinopathy. Once retinopathy is well established, different treatment options are available, including laser treatment, drug treatments, and a surgical procedure known as vitrectomy. This course has been made possible with the financial support of Rush Diabetes Care, a division of Hoffman La Roche Limited.